All right. Hello.
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 It's a good afternoon today.
Yes. Yeah, this is one of the first times we've done an afternoon version. My morning just didn't allow for a morning podcast or really anything else, so thanks for flexing with me.
That's okay. We got it.
Yeah.
We got it.
Yeah. So we'll dive right in. This is going to be
Yeah.
pretty quick to the point, I think, but it's a really important topic. So, like the title says, we're talking about carpal tunnel syndrome, yes. But the real thing we're going to talk about today is energy. Energy delivery, energy dosing. How do you use your laser to the best effect? And it is going to be we're talking about a study on carpal tunnel syndrome, but there's a really fascinating study that directly head-to-head compared low-level, low fluence versus high-intensity, low and high fluence. It's a great kind of comparison of the effects of both Class 3 and Class 4 lasers in terms of at least carpal tunnel syndrome. Not other syndromes necessarily, but it gives us some insight into how these laser dosing mechanisms work. So before I go any further, my name is Jason Roundtree. I'm a chiropractor and certified medical laser safety officer. I am the founder of Laser Therapy Institute, which trains providers in the proper use of laser therapy devices. If you want to know more, go to our website, lasertherapyinstitute.org.
Lots of information.
Lots of information. Lots of free tools as
Exactly.
well. You could get those downloaded, start enhancing your laser practice today.
Exactly.
That's right.
Exactly. Everything's good free.
Yeah, I mean, everybody likes free stuff.
Yeah. But
So-
then sometimes you have to pay. So-
Well, there are some things that we do charge for, absolutely. Personalized coaching, custom settings. Most of the protocols that we have they require some level of extra education, so they are something that you can pay for. But you could sign up for and go ahead and take courses that we have available right now, like neuropathy,
Right.
sports med, spinal conditions. That comes with custom settings. It comes with protocols for those conditions. And it's all online. So you can do it whenever you want to. There's a ton of great info on there. And that's in addition to all the free stuff we already offer. So if you haven't checked us out yet, you need to.
You need to.
Yeah. I'm joined today by Christy. Christy is a certified laser therapy technician. She's delivered a ton of laser treatments over the years, and she's currently the developer and head honcho of our online learning materials. So I change it up a little bit each time,
You do.
just to make it sound cool. But let's go ahead and get into it. So I'm going to give you the reference that we're talking about today. This study came out in 2019, and it's titled "A Comparative Dose of the Dose-Dependent." I'm sorry. Let me restart that. A comparative study of the dose-dependent effects of low-level and high-intensity photobiomodulation laser therapy on pain and electrophysiological parameters in patients with carpal tunnel syndrome. We're going to get into most of that here in a minute, but it's a very, very long title. The nice thing with this particular study is it is open access. So we'll drop the link to the study. You can read the entire thing. You can see the diagrams. You can look at the information for yourself. I'm just going to try and bring you some of the really interesting things that you should be able to use as a clinician, if you're a laser therapy clinician, in terms of selecting the right laser equipment and the right dosing, at least for nerve injury, mononeuropathy patients like carpal tunnel syndrome patients. So let's just set the scene here, though. We're really going to be talking ultimately about energy. Light is a form of energy. If you want to stimulate a positive change in a biological system, you have to have energy used and energy created. When it comes to laser therapy, we're talking about delivering energy, light energy, in a way that it stimulates mechanical and thermal and chemical energy changes within the cells in a positive way. And so we have to have a way to kind of manage and measure energy dosing.
Right.
And we use the term joules to represent a packet of energy, basically. And then we have to know how large of an area we are applying this energy to in order to figure out the intensity, the total energy being delivered. So we do this in terms of joules per centimeter squared.
Do you have to be a mathematician to figure this out?
Thankfully, no, because
Good.
I'm terrible with the math. So it's just as simple as taking the joules that
Right.
you are delivering over treatment and figuring out how many square centimeters you're applying those joules to, and that gives you the joules per centimeter squared. It's the most common way of measuring energy in light therapy. And some cosmetic laser treatments as well use joules per centimeter squared. Hair removal a lot of times will happen at about 50 joules per centimeter squared with the proper intensity to actually burn the hair follicle. And of course, that's not what we're talking about when we're talking about laser therapy.
Right.
Laser therapy is a therapeutic effect. And so the energy measurement here, the joules per centimeter squared, is what we're going to refer to for how much energy is being delivered. Now, it does say laser therapy, and these researchers in this study did use lasers, but you can deliver light however you want. You can use a light bulb. You can use an LED device, right? There are other factors here, but energy is energy. Light is light. It doesn't care where it comes from. Now, it might behave differently. It might be a different color based on its source.
Or wavelength.
Yep, wavelength. But ultimately, it's just energy. So we're going to try and just keep this in terms of energy. How much energy do we need to deliver to produce good tissue effects? Is 1 joule per centimeter squared enough, or do we have to be at 50? And then how intense should this energy delivery be? So that's basically how bright does the light need to be in order to deliver these tissue effects. Those are the two factors: how much energy and how intense. Okay. Now, I already mentioned laser hair removal, laser hair reduction, laser epilation, as it's called. And if you have if you have the right wavelength of laser at the right energy density, say around 50 joules per centimeter squared, sometimes more, and you have it at a very, very high intensity, then what happens is the hair follicle, being darker than the surrounding skin, soaks up the light, and you get a very thermal, photothermolysis effect. That you superheat that hair bulb, and it fries the follicle, and then not the tissues around it.
Just the follicle.
Just the follicle, because it's a dark hair, so it's soaking up more of the light. So that's on the kind of destructive end, right? We're using selective destruction in that case. Works amazingly well. But on the therapy end, we're not targeting a hair follicle, right?
No.
We're actually targeting parts in the cell.
Right.
Mitochondria, specifically cytochrome C oxidase, but also circulation, hemoglobin, water. Those are all targets for laser therapy. We want to do it at an intensity where we can make a change, and also at a dose delivery where we can make a change. What does that look like?
Right.
Okay.
Right.
This is where it gets really confusing, because a lot of the laser therapy device manufacturers or LED device manufacturers, they will say, oh, well, you don't want to have really high power because it's going to cause burns, or oh, well, you don't want to have really low power because it won't penetrate. So these guys just said, okay, let's just put this stuff head to head. Let's do a 50 milliwatt laser versus a 1.6 watt laser, right? So very, 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 very small spot size 50 milliwatt laser versus a larger spot size 1.6 watt laser. The 50 milliwatt laser is at 860 nanometers. The 1.6 watt laser was at 808 nanometers. They're fairly close, about 50 nanometers apart. So small difference, but not a huge difference. The main difference here is the intensity, right? The 1.6 watt laser is going to deliver a higher intensity.
Right.
So the next question then, if we got that intensity difference, is how many joules should we be delivering? What's the total energy that we should be putting in? And the data on carpal tunnel syndrome with laser therapy studies is pretty conflicted. There's some with very little total energy. There's some with tons of total energy. So it can be difficult to kind of figure out, what level's going to be best. Some of the studies show positive benefits, some don't. So what these guys did, they said, all right, we're going to take this 50 milliwatt laser, and we're going to apply a dosage of 8 joules per centimeter squared, and we're going to apply for this one group, and we're going to apply a different dosage of 20 joules per centimeter squared in another group.
Same laser.
Same laser,
right?
Just more time. Same power level, just more time. Because the longer you apply the laser, the higher the dosage goes.
Right.
So they did the same thing with the higher intensity laser. They said, okay, let's try 8 joules per centimeter squared. Let's try 20 joules per centimeter squared. See what happens. So they basically had these 4 groups, 90 total subjects plus a control group for this study. So pretty great, double-blinded, the whole bit. So 5 total groups. All 5 groups got some basic home exercises. So that's all the control group did. You had one group with the low-level laser, got the low fluence, the 8 joules. and the low-level laser with the higher fluence, the 20 joules per centimeter squared. And then you had the high-intensity laser with the same distribution, 8 or 20. So 4 different experimental groups to compare. Pretty darn good comparison.
Yeah. Normally there's not that many groups and different, multiple settings
Right.
to work with.
Yeah, so most of the studies out there do, an experimental group, a control group, one single type of laser, one single type of setting.
Right. So this is exciting.
Yeah, it's pretty good. It's pretty good. So they went ahead and they took these different groups. They applied laser every day for 2 weeks, total of 10 treatments, so 5 days a week. Not every day, I guess, but 5 days a week. Did it for 2 weeks, and then they did a follow-up 3 weeks later. And they measured before and after, not only pain, but also EMG performance, so how well the nerve was transmitting information, right?
Now, is the time the same for each group?
That's a good question. No. So the only way to deliver more energy without changing the power level is to do it for longer time, or do a smaller area, actually. If you do a very, very tiny area, you can deliver, a large fluence to that small area, but if you do a larger area, it's more difficult. So for the 50 milliwatt laser, they applied that laser for either 32 or 76 seconds at each point. That got them to either 8 or 20 joules per square centimeter. With the higher intensity laser, it was very, very similar, either 100 or 250 seconds. They were treating a larger area, though, because you had to do a scanning motion with that laser handpiece.
Because you said points on the first group.
Right.
So
it's
how many?
held.
Okay.
So definitely a time difference to get that difference in setting, but yet keep the intensity of the light, the brightness of the light, the same for those groups, right? So comparing the benefits, every single group did get better. Even the control group that was doing basic home exercise stuff, they did get better, a little bit better, not a ton. But they conclude that the results of this study demonstrate that laser therapy not only reduces pain, but also changes the electrophysiological parameters of the median nerve in carpal tunnel syndrome. However, changes in pain, motor nerve latency, and amplitude in the high-intensity laser group with the lower fluence demonstrated greater improvement than other treatment groups. So out of the control, low intensity at 8 joules, low intensity at 20 joules per centimeter squared, high intensity at 8 joules per centimeter squared, and high intensity at 20 joules per centimeter squared. The one that won out of that 4-way competition was the high intensity laser with the lower total dose, the 8 joules per centimeter squared. Even though they all got better. Okay? So that's kind of your answer there, really, that the high intensity laser is probably going to do better because it outperformed the low intensity laser, even at the same total energy.
Right.
Because the greater intensity evidently delivered more effects. They say the high power, low fluence laser therapy resulted in the greatest therapeutic effects, not only on pain, but then also on nerve performance. They concluded that anatomical variations in nerve distribution, as well as the lack of transferred energy to the nerve due to soft tissue blockage, are the main reasons for failure of treatment using lower dosages of laser therapy. Now, the interesting thing here is they used some fairly low doses. 8 joules per centimeter squared is right in that typical window of what we often see. But they could have gone a lot higher, and they did go higher, and they still got good results with that. So there's a large window here where you should be able to help patients, even if it's not perfect, even if you have a low intensity laser, as long as you're hitting these dosage, somewhere in the neighborhood, that's good. But if you're down at like 1 joule, you're probably outside the bounds. If you're at 40 joules, you're also probably outside the bounds. If you're in this, even 5 to 20 range, you're probably in pretty good shape, especially if you can cover a large area, because then you're dealing with this anatomical variant situation. If the nerve runs instead of right where you expect it to, if it's just off, or you have a bifid median nerve, which I've seen on ultrasounds, you might be missing part of it.
That's why the wider area is better, because it gets more of it.
Exactly.
You have more chance to target the area you're after.
Right. Yeah.
So.
Because unless you're actively ultrasounding the region, or if you have X-ray vision, which would be cool, then you just don't know. You can think you're in the right area when it comes to trying to target a nerve, but it's much easier to take a big spot size, high intensity laser and just be able to blast the whole thing because you're not going to miss it.
Now this is actually repairing the nerve too.
That's exactly what they saw. Yes, not only dealing with pain and the sensitivity changes, but actually getting the nerve repaired in a way that it transmits those signals faster, which is the nerve's job, is to transmit signals quickly.
Right.
So the takeaway here is that, if you have a high-intensity laser, more is not always better. 8 joules versus 20 joules per centimeter squared, and the 8 joule range actually performed better than the 20. But the higher intensity lasers probably are going to get better results.
You can still get results with the lower intensity, just it's going to take longer.
Right, it's going to take longer. You might not get the same repair effects. They noticed that they did have, pain relief effects with the low level laser, but much less nerve repair. But yeah, maybe doing it longer would get you there. It'd just take a little bit longer.
Yeah, high intensity is it.
Yeah. Yeah, it appears to be. In the few studies like this that are head to head, the high intensity lasers typically win if they're set up correctly. The difficult thing is that we do have, in a lot of cases, differences between the protocols that cannot be really accounted for. In this case, they did pretty darn good. I think it probably about as best as they could. Yeah, there's a little bit of a wavelength difference, but it's not that much. Those two 860 and 808 nanometers, they really behave fairly similar. So I think this is a good combination. Does this apply to other conditions? Potentially. Treatments or conditions like tarsal tunnel, sciatic pain. Those are nerve conditions, mononeuropathies that are not too different necessarily from carpal tunnel syndrome. So this may apply elsewhere too. When it comes to tissue repair in general, it probably does translate over, even though we don't have other studies like this for other conditions.
Right. Exciting stuff.
It is. It's nice to see that kind of head-to-head. If you've got questions about laser dosing, if you've got questions about what kind of light therapy device you should be using or purchasing, or this is one I field often. Well, the laser sales guy told me this. Is that really true? Yeah, get a hold of us. We'll be happy to walk you through the process of laser device comparison. We actually even have a tool for that on the website, totally free. We do, in general, for most clinicians, end up recommending a high-intensity laser, but there's a ton of them out there, and many of them can be effective. And for some people, LED panels, full-body devices, low-level lasers may be a better fit. So we can talk to you about your particular needs, your clinic model, what you're really going for, and be happy to discuss.
Right. Sounds good.
You can also email us, info@lasertherapyinstitute.org, or reach us through the website. Otherwise, we'll be back in a couple weeks with some more research that hopefully helps your practice.